like and subscribe. Americans, do you want universal healthcare? Why not? Americans, you're already paying for healthcare, you're just not getting it. Your money is going elsewhere. My daughter had a fever abroad in France. We debated frantically if we should take her to the doctor, because we didn't know how our insurance would cover it. We thought the worst, and that it was covered. The doctor did a full exam for $30. We were expecting a huge bill after. Nothing ever came. Yeah, the healthcare system in the USA is utter corporatized filth. Burn it to the ground. I got stabbed 10 times standing up for a woman. I was charged over $10,000 for the ambulance ride, surgery, and additional medical. It was worth every penny. But I was left in debt before my adult life started. I don't want to change providers every time I change jobs. I also don't want to prop up an insurance industry worth billions of dollars. So, yeah. I am sitting in my house with a torn something in my knee, probably life still bleeding, based on the spreading bruise, waiting 2 weeks for some lucky to decide that I am worthy of an MRI, because I cannot talk to an ortho without an MRI because rules. Also, I can pay for the visit, MRI, and probably most of the PT out of my own pocket, which will set me back years financially. Yay, I want health insurance I can go use when I actually need, and not worry about it ruining me. Give me all of that goodness. Edit, I should add that I have insurance. I have a kid and my deductible is like $6,000. So I may as well not have insurance. I had a pretty well paid job making sure the health system I worked for got reimbursed by health plans. 100,000% support universal healthcare. I have an arsenal of stories on how truly up the healthcare system here is, but here is one that has stuck with me. Reviewing a high dollar chemotherapy claim that was unpaid with my team. Ask them to pull the EOB explanation of benefits that essentially outlines how the health plan paid what they did, or why they did not pay. The health plan had marked the entire amount, over $200K, as patient responsibility, meaning they were telling us to bill the patient for it. I personally called my counterpart at the health plan, because it seemed like a mistake. Nope, turned out the patient exhausted their benefits, meaning they essentially ran out of coverage per the terms of their health insurance policy. This was a PPO plan the patient had through work. In other words, this patient, who is now fighting for their life, and still in the middle of a cancer battle, is going to get saddled with a 6-figure medical bill despite doing everything right, by getting good coverage through a good job. Quite frankly, if the cancer did not kill them, the stress of figuring out how to pay that would have. This same health plan had an insanely ritzy office, and so many perks for their executives it was beyond belief, yet held non-profit status. Made me sick to my stomach. I left healthcare. Edit to add. As someone who has seen the inner workings of the financial side of healthcare in the US, I can say with 100% confidence that there is no good reason someone should not support universal healthcare unless you own a ludicrous amount of health plan stock or at the executive level of a health plan. Please bear in mind that many countries that have universal healthcare still have private options, so you are not entirely without choice. My current job is slowly driving me insane, but I can't leave, because my health insurance is through them, and I can't take half the jobs I want, because they either don't have it, or have strings attached. If we had universal healthcare, I could take far greater economic risks without having to worry about potentially being saddled with life-altering debt from a clumsy misstep. Yes. I have worked in healthcare for 25 years and I cannot afford to go to a doctor. They act like it is some huge favor for the insurance companies to pay for yearly preventative care, but God forbid they find anything on us. Deductibles are so high that I'll go broke trying to pay for addition testing and treatment. Yes. Because cancer is a I had good insurance and it still ed me over. I'll spend the rest of my life trying to pay this off and chances are I never will. I am not even 30 yet. I had a staph infection on one of my toes. I ignored it. I ignored it until my foot was almost the size of a football, American, and half my foot was black. I couldn't afford to take time off, so I kept working when it started. I worked the night I finally asked a friend to take me to the emergency room. The only reason I decided to go was because I got *extremely* drunk, like 3/4 of a 1.5 liter bottle of Sailor Jerry's drunk. I was worried about the $sign. Anyways, I got x-rayed, stuck in the magnet tube, and had a bunch of tests ran. My main doc told me that I had to choose between half of my foot or half of my leg getting amputated. I chose half foot. When I woke up, I still had my foot. Something about the infection not getting into my bone. Doc also mentioned that there was evidence of maggots when he abraded the corrupted flesh off of me. I was in the hospital after that for a week. My bill was almost $200k USD. That is insane. Yeah, I'd have been better off booking a first-class flight to London, paying for a ride to the hospital in a Maybach than spending a week in the Ritz Hotel recovering before flying home. Yeah, I'd only be down about 30k. Absolutely. And I would happily pay more taxes to make it happen. Everyone deserves the opportunity of early diagnosis. Everyone deserves medication to heal. Everyone deserves a quality life. I did not get glasses until I was 26 because I was afraid of the cost. I still have my wisdom teeth that flare up sometimes and cause pain. I want to contribute so people are not financially ruined for being in an accident. Human resources rep here, and I say absolutely. Every month I have to give benefits meetings and help employees coming from other companies or unemployment make decisions on insurance as well as those moving on to go somewhere else, and help them all make potentially life-changing decisions on insurance which they really don't even understand the basics. PPO VHMO. FSA VHSA. Deductible, co-insurance, copay, out-of-pocket maximum. The glazed eyes I see. It reminds me of how my college allowed credit card companies to sign up 18-year-old kids who knew nothing about finances or credit back in the 90s/early 2000s. Yes. I want my relationship with my work to just be about money. My job and health insurance should not be intertwined at all. As a Brit, this widespread repulsion towards the *VERY idea of universal healthcare totally baffles me. I so often hear screams of socialism or communism. Just from hearing *DISCUSSIONS* about the *POSSIBLITY* of implementing it. I'm sorry, but if all you need for something to meet the definition of socialist or communist is for it to be provided by the government and paid for out of general taxation, then why isn't the US military socialism? And communism? Or the police force? Or the fire service? In the UK, we have both public *A and D** private healthcare. There's a national health service which is free at the point of use for all, available to all, and paid for out of general taxation. This means everyone in the UK is guaranteed healthcare, regardless of their social economic situation at any given time. We also have private healthcare, for those who want, and are able to pay extra for it, which gives them the potential for faster access to care, or a choice of their own specialist, private GP, etc. Depending of course entirely on what level of cover they take out. These things are far from perfect. The NHS is a constant political ping-pong ball here in the UK, and is always one of, if not the biggest topics come election time. But the idea of not having healthcare, free at the point of need, and available to everyone. Unthinkable, to me. Yes. I don't think it's fair for someone to have to decide between feeding their family, or taking insulin for their diabetes, or going to the hospital because they're sick. The richest country in the world and you can't even go to a doctor. What a I'm scam, mate. Reading all these comments I have concluded that never be sick in America. Dear God, yes. Just let my taxes take care of it, and cut out the blood-sucking health insurance middleman. They add nothing to our society. They have allowed the American healthcare system to explode the price of services and medications, because the consumer does not pay the real price, as long as they have insurance. In turn, insurance premiums have exploded. Everyone involved makes billions off of the sick people who need care, and prioritize any way they can avoid actually providing that care or insuring it. I am already paying for my insurance, so just use that money. Plus, employers who cover it will not need to pay those premiums, and could pay workers more. I really challenge anyone to tell me why I should not want one. My infant son passed away after being in the NICU for 5 days. Luckily my partner and I each had different health insurance companies, so the NICU stay was mostly covered. The total bill was $56,000 for a baby we never took home. After double coverage, we owed $3,500 out of pocket. United States healthcare. Absolutely. I feel anyone who is opposed to universal healthcare just really hasn't taken a look at the numbers. Virtually every American, yes, you, stands to save money with a universal healthcare system. Every other developed nation is paying around 1/3 to 1/2 our healthcare costs per capita, with similar quality of care metrics. Anyone who wants to pay 2x to 3x the price for the same service is an idiot, full stop. I have MS. My healthcare was so much I stopped working, and had to let my income fall below poverty line E, so I could get Medicaid, otherwise I would have died. My monthly medical expenses was twice my salary. Either way I'm broke. At least this way I don't have medical debt. So yes. Of course. I am tired of paying more for less. My parents got divorced when I was 6, and it was a nasty, hateful, and spiteful custody battle for nearly a decade. While in my mother's custody at age 11, my grandmother died. It destroyed my already struggling mother. A couple months prior was my most recent dentist visit, and my last. My father got custody of me, just as I turned 13. He's a Q-adjacent nutter nowadays, but he's always been a bit irrational and arrogant. Took me to the doctor once he got custody, to get me ripped off my asthma meds, and never took me again. Even if he wanted to, he was too broke to take me again. I remember my brother getting 3rd-degree sunburns and my father just giving him a few bottles of aloe and fish antibiotics. Took myself to the ER at 18. A massive amount of blood and my abdomen was in the greatest pain of my life. Doc said it was inflamed, made me poop in a hat, sent me home, charged me $15K. I swore off going to the doctor after that until I found a stable and consistent insurance policy that wouldn't leave me homeless. I'm 25 now. Haven't been since. Also, a bit more context, I've had chronic tooth pain since I was 17. It ranges from mild annoyance to me debating getting drunk and having somebody rip them out with pliers. I'm recently unemployed, and thanks to COVID Medicaid expansions, I qualify for a medical card. For the first time in my adult life, I got to go see a dentist last week. They are scheduling me for a deep cleaning. Apparently all my teeth can be saved. Need the wisdoms removed though. I also finally got glasses I've desperately needed since I was young. It's concerning that I was driving before without glasses. I also am getting some other chronic medical issues looked at in the coming months. Even with a medical card, it hasn't been easy. No oral surgeon within 3 hours of where I live accepts Medicaid, unless you're under 18. So I've got to drive clear across the state to get my wisdom teeth removed. No dentist within half an hour, so I have to go out of county to get cleaned. My local doesn't take my form of Medicaid, so I have to go to the next county over if something comes up. I've had to spend hours calling literally over 100 places to find something that accepts Medicaid. Worse, I've had a few instances where the secretary volunteered all the common forms of insurance they don't accept. Did you know that there's no shortage of private reputable insurers that are just widely unaccepted? You can have top-end insurance and still struggle to find a doc in your area. I'm so God angry. I did it by the book for 7 God years. Worked full time from 16 to 23 non-stop. Part time afterwards, because I enrolled into university. Didn't take my first day off until I got the flu. Busted my tried new jobs. Learned new skills. Never had the opportunity to get basic medical help. I did it all. Landscaping, factory cleaning / assembly, warehousing, mechanic, freelance marketer, freelance auto mechanic, farm equipment mechanic, non-profit carriage driver, forklift operator. Hell, I found myself as professional TCG player / vendor. Never once did I find myself in a position to where I could see a God optometrist, dentist, or general practitioner. Nobody, especially not another child, deserves to go through what I've experienced. Our system is broken, and we need to take drastic measures to fix it. Anybody that says otherwise is a delusional sociopath and needs kicked in the God teeth. You know what universal healthcare does? It makes it to where kids in rough homes can just walk in and schedule their own God appointments when their parents are too nuts or poor to do it for them. It makes it to where people like me, who can barely afford to live, don't have to drive 3 God hours to get a tooth ripped out. Maybe my case sounds extreme, but it's not. 1/3 Americans are in the same boat. As far as I'm concerned, there's no reasonable or rational debate against universal healthcare. The opposition has had decades to find a counter-proposal, but they'd rather pretend there isn't a problem. Them and anybody that aligns with them. Not only am I entirely in favor of universal healthcare, I'm here to attest that anybody against it is a worthless piece of unworthy to be fed to pigs. You've been visited by the ghost of a very important man. Pay your respects by liking and subscribing, and he'll grant you 3 weeks of good luck.